Long waits at the pharmacy are adding frustrations to the COVID-19 pandemic. Some pharmacies are now closing at lunchtime due to a staffing shortage. There is a nationwide shortage of pharmacists and the staff that usually helps at your neighborhood drugstore. Our Y Guy explains the impact. It's all new this morning.
Frustrations at the pharmacy are impacting the people behind the counter and the customers waiting outside. 11 Alive viewer Rhonda Nelson's most recent trip to the drive-thru shouldn't have lasted that long. It did.
And there was 2 cars in front of me, and those 2 cars, it took 20 minutes before they got to me. It's just absolutely ridiculous.
Georgia is among the states facing a shortage of pharmacists and pharmacy technicians.
Most pharmacies I've talked to are 1 to 2 positions behind.
Let's look at why it's an issue that began even before the pandemic. According to the most recent numbers from the Bureau of Labor Statistics, Georgia saw a 5% drop in the number of pharmacists between 2019 and 2020. The Bureau is projecting a 2% decline nationwide over the next 10 years. Added stress brought on by the pandemic has had a major impact.
They've given vaccinations, they've done COVID testing, now they're doing the COVID oral antiviral.
Dr. Jonathan Marquis of the Georgia Pharmacy Association owns his own pharmacy. He says he's had employees take early retirement and talk to others who've had second thoughts about working in healthcare during a pandemic.
Even though they were vaccinated, they felt it was too much risk to be in the healthcare setting, so they said, I'm either going to decrease my hours or not work until maybe the pandemic is totally gone.
Many pharmacies have been left short-staffed because of the pharmacy technicians who've left the industry. They help fill prescriptions while making less pay than pharmacists. In light of that, Walgreens and CVS recently announced they're increasing the pay of all of their hourly employees.